New York firing healthcare workers as COVID heads to the Northeast. By Matt Welch. Published at Reason on September 28th. Read to you here at Paloma Media on September 29th. For most of spring 2020, rattled New Yorkers trudged out onto their stoops and balconies every night at 7 p.m. sharp to bang their pots and pans and holler their appreciation for the first responders, cops, nurses, doctors, EMTs, firefighters, and so forth, who, unlike them, did not really have the choice to stay home from work while the deadly coronavirus ripped through the 5 boroughs. As of Tuesday, those same New Yorkers, through their representative government, are telling those same essential workers to go look for a new job, unless they have been vaccinated for COVID-19 or have filed for a religious exemption from the state's vaccination mandate. The only way we can move past this pandemic is to ensure that everyone eligible is vaccinated, and that includes those who are taking care of our vulnerable family members and loved ones, Governor Kathy Hochul said in a statement on Monday, while she was signing an executive order easing various licensing requirements in order to expand the pool of potential healthcare workers. The governor is keeping open the option of calling on the National Guard to cover for expected hospital staffing shortages. New York's vaccine mandate, which covers 600,000 healthcare workers, is one of scores across the country, affecting nurses, doctors, teachers, and cops. The North Carolina-based hospital company Novant Health announced Monday that it had fired 175 unvaccinated workers. According to the Washington Post, quote, more than 150 healthcare workers who did not comply with the vaccine mandate at Houston Methodist, one of the first health systems to require the coronavirus shots, were fired or resigned in June after a federal judge upheld the policy. ChristianaCare, a Delaware health system, announced this week that 150 employees were fired for not adhering to its vaccine mandate, unquote. The requirements are exacerbating existing staff shortages in the healthcare sector 19 months into the pandemic. But are they increasing vaccinations? Well, yes, appears to be the preliminary answer. New York announced its mandate August 16th. Between then and late Monday, vaccinations of at least one shot among staff at nursing homes increased from 70% to 92%. At adult care facilities from 76% to 89%. The hospital worker vaccination rate rose from 77% in mid-August to 84% as of September 22nd. There has been widespread reporting of a rush of health sector vaccinations in the final hours before the deadline. According to a soon-to-be-published nationwide poll of more than 1,000 Americans funded by the Robert Wood Johnson Foundation, 16% of employed respondents said they would quit or start looking for new work if required by their employer to get a vaccine. Quote, among those who said they were vaccine hesitant, almost a quarter of respondents, we found that 48% would quit or look for another job. Pollsters Jack Berry, Ann Cristiano, and Nyman wrote. Other polls have shown similar results. A Kaiser Family Foundation survey put the share of workers who would quit at 50%. Yet, those same authors conclude, the actual number who do resign rather than get the vaccine is much smaller than the survey data suggest. Well, this week will be the test of those theories. Since Connecticut's statewide healthcare vax mandate took effect Monday for public hospitals, California's kicks in Thursday, Rhode Island's on Friday, and there's a bunch of teacher mandates coming in line very soon, including in New York City, I think as of Friday now. As the Associated Press notes, in a development that mirrors COVID-related educational restrictions, states that have set such requirements tend to have high vaccination rates already. The highest rates are concentrated in the Northeast, the lowest ones in the South and Midwest. This all raises, in particular, some uncomfortable issues of class, as six-figure big city professionals cheer on, or at least shrug at, the firing of working-class nurses, EMTs, and support staff. Spring 2020, this ain't. Soon, however, the impact will be spread out all over the country after the rollout of President Joe Biden's mandates on private employers having more than 100 workers, plus on all 17 million employees at healthcare providers that receive Medicare and Medicaid, and every federal employee, including military. Centers for Disease Control and Prevention estimate that right now 77% of Americans age 18 and older have received at least one shot. 67% are fully vaccinated. The U.S. right now is 45th in the world of vaccinating its entire population at around 64%. The most compelling arguments for government to mandate injections into people's bodies is when those people, A, work for the government, and or B, work in close proximity to at-risk populations, which at this point disproportionately means the elderly, the sick, the immunocompromised, and the unvaccinated, particularly those unvaccinated who fall into those prior categories. The state is on far shakier ground legally, morally, and medically when mandating jabs for low-risk populations outside its employ. For an explanation of why someone might not want to take the vaccine, go take a listen to a remarkable 2-minute statement from professional basketball player Jonathan Isaac of the Orlando Magic. It's linked in my piece. I would drop it in here now if only Audacity allowed one to easily drop in a stereo link into a mono file, and or if I had used to learn Audition in the last 10 minutes. Didn't. Sorry. Go listen to it. Come back when you're done. And then go enjoy Rolling Stone magazine describing Jonathan Isaac as an anti-vaxxer, because that apparently is how we're doing music journalism in 2021. The NBA does not have a league vaccine mandate on its players. The lower paid staff is another story. But government mandates in New York City and San Francisco mean that 3 teams, the New York Knicks, the Brooklyn Nets, and the Golden State Warriors, will be subject to these requirements. Brooklyn star point guard Kyrie Irving, who's a little bit touched, and Golden State forward Andrew Wiggins have been talking about missing all of their home games rather than comply with the mandates. Far more consequentially, public school districts are beginning to adopt and enforce vaccine mandates on all eligible students. Culver City, California, started the trend in the fall, followed soon by the Los Angeles Unified School District, the second largest in the country. San Diego Unified approved a mandate just Tuesday night on students 16 years and older. New York Governor Hochul said this week that she looks forward to being able to add COVID to the regular schedule of mandatory school inoculations against stuff like polio and the measles. In a sign of blue state policies to come, Education Secretary Miguel Cardona endorsed student vaccines last week. "I wholeheartedly support it," Cardona said during a visit to Detroit. "It's the best tool that we have to safely reopen schools and keep them open. We don't want to have the yo-yo effect that many districts had last year, and we can prevent that by getting vaccinated." Note the emphasis on the importance of vaccination, not necessarily to keep kids safe, but to keep schools open. Yet, even unvaccinated kids remain overwhelmingly less likely to contract, spread, or suffer from COVID-19. Fears of the new school year generating a new surge of cases have thus far proven unfounded. And the situation that Cardona is trying desperately to avoid, which is remote learning, which is terrible, will likely increase in communities where parents are skeptical about the cost-benefit ratio of vaccinating their kids. Just Tuesday, the LA Unified School District, which besides the student vaccine mandate, tests everyone, staff, students, every week, regardless of vaccine status, came out with new enrollment figures for the fall year. They were 3 times worse than what had been projected, a drop of 6% in just 1 year, after already falling 4% the year before. Lose 10% of your students, 2 years. Conclusion preliminarily might be that forcing vaccines on the unwilling has more consequences than merely increasing vaccination. So we're kind of in uncharted territory here. If even 3% of any given population that is given a mandate decides not to comply, even under threat of government reprisal, that could have huge impacts on public education, on the economy, and on hospital capacity. It's on that latter point in particular that policymakers should be looking at closely over the coming weeks as they fire nurses and think about mobilizing the National Guard. After the brutal COVID-19 wave in the South this summer, the 10 states right now with the biggest percentage increase in hospitalizations over the past 2 weeks. Go check out the New York Times calendar. Just always keep refreshing that. Those 10 states are all in the north. The southernmost is West Virginia. And the leaders are two super highly vaccinated states, Vermont and Maine. Vaccine mandates may well be the last push that results in the U.S. reaching some mythical pandemic off-ramp. But they may also create healthcare shortages in the Northeast right as the virus is once again rearing its seasonal and regional head. Rearing a seasonal and regional head. That's a sentence. It's fine. It's worth thinking through these problems before reaching for the heavy hand of government compulsion. That's the memo.